If you ask Bill, he's gonna say he's just an ordinary man. But he actually made extraordinary impact.
Bill is a visionary. He is really good at setting the vision, gaining support for that vision. He's very collaborative, he's very inspiring, he's very supportive.
Having somebody that you believe has integrity and respect for others, that kind of seals the deal.
And that's how I see my role, is to try to help others be more capable of delivering on the mission of the organization. Because healthcare is all about a team. It doesn't happen with one person, it happens with a collaborative environment.
Bill models for all of us that balance between making sure that an organization is growing and thriving in combination with doing that on behalf of the community.
When the board hired Bill Robertson, they asked him to do something different. So how do we go from a top-down command and control organizational structure to one that's of teams? We have approximately 32 interdependent business units that are responsible and accountable for running their organizations. And we think that's going to be more flexible and more agile to serve people.
He's been really articulate about his vision, and about a vision that those of us in healthcare who really believe in community-based care, population health, that resonates.
That's one of the things I find attractive about this region and working in this community. And I think that in the behavioral health space, that was fully on display in this region. We had 70 or so individuals out of our community, everywhere from congressmen to civic leaders to labor to education, law enforcement, a whole cadre of people who work together to say our community needs better access to behavioral health care.
He's always willing to look outside the box, not be bound by kind of the status quo that others are used to. And a great example of that is the behavioral health hospital, something that we needed desperately in this community. We've been without for over a decade. And the whole prospect of collaborating in a joint venture with his #1 competitor was very unique, and bringing in the community in a unique and important way.
He actually encouraged us and challenged us, inspired us to move from what we seem to think is the impossibles to become possibles. So he brought out the best of us from our organization.
We obviously will always have part of our mission taking care of people who are sick or have experienced trauma in some way and need to get back to health. But we think that we win better for our communities because we're a nonprofit, community-based organization when we can help our community be healthier. And we must do that and want to do that in partnership with others.